hands. Hi, I'm Carol from SADS Hong Kong Foundation, and I will be your host for today's webinar. I'm sure lots of you have heard about these terms like sudden cardiac arrest, CPR, AED, but really, how many people of us are sure of what these terms are? And more importantly, how do we react when we encounter a victim who suffers from cardiac arrest? Lately, we have heard of the Danish footballer Christian Eriksen collapsing right in the middle of a game from sudden cardiac arrest. In Malaysia, Marquis at Quito, an Olympic Games champion badminton player, also collapsed last month during one of his usual training sessions. Today, in this webinar, we will be discussing these very real topics, and we have also invited external speakers who have personally rescued a victim, as well as a survivor of a cardiac arrest to share their personal story. So, do stay tuned to the end. First up, we have Dr. Jimmy George, who works in Shu Medicals as Clinical Marketing Manager. He also has the experience to rescue victims with AED. He will explain some of the popular myths of cardiac arrest, as well as teaching us how we should all react when we encounter a victim suffering from it. Dr. Jimmy, over to you.
Hello, everybody, and thank you, Carol, for the kind introduction. My name is Dr. Jimmy George, and thank you for inviting me to this wonderful webinar entitled Hope is in Your Hands. So today I'll talk about several topics, and I will start on with the topic of what is a sudden cardiac arrest. And also I would like to debunk some of the myths that has been asked to me like several times. So myth number one, is sudden cardiac arrest the same as a heart attack? The answer is no, they are not the same. In fact, heart attack is a very common term that we hear often nowadays. It actually occurs when the heart, there's a buildup of a plaque in the coronary artery of the heart. So this buildup of a plaque actually blocks the blood flow to the lower portion of the heart, causing dead heart muscle cells. So typically in this heart attack, you will encounter victims that looks like this, whereby he looks to be in pain and also the hands putting on the chest. This is also coupled with difficulty breathing and also profuse sweating. But bear in mind is that heart attack, during this time, the victim continues to have heartbeat. He or she will also be breathing and still in a conscious state. But in terms of sudden cardiac arrest, it is actually a disruption of the electrical conductivity of the heart. So this is important because this disruption causes the heart to be not pumping the blood at all. So there's no blood flow to the brain and also the important organs within the human body. So typically when a victim suffers a sudden cardiac arrest, he or she will be unconscious, no pulse, and also not breathing. So this is very critical and also a life-threatening situation because life and death could just be a matter of minutes. And in fact, the treatment is two things. Number one, CPR, also called the cardiopulmonary resuscitation, and also defibrillation with an AED. So myth number two, sudden cardiac arrest only occurs in the elderly people. The answer is no. It actually occurs in all age groups. So I actually drawn a picture from an organization in the UK called the Cardiac Risk in the Young. This is an organization that prevents young sudden death in the UK by creating awareness and also helping and supporting families of the affected victims. What you see here, it shows that there are actually an average of 12 young sudden death in a week happening in the UK. And of course, every single loss is a heartbreak to the affected families. This is the second picture, which is very relevant to me because I'm a badminton fan. So what you see here is actually a badminton player called Marquis Kido, which is shown in the green color arrow. He's actually a badminton champion in the 2008 Olympic Games in Beijing. He actually passed away at the age of 36 while playing leisure badminton in Indonesia. And this occurred actually quite recently. It was like in June 14, which was 1 month ago. In fact, one day before the collapse of Marquis Kido, the sudden cardiac arrest occurs in the UEFA Euro 2021 games as well. So for all the football fans out there, you know that Italy just won the recent Euro tournament. It's actually a competition, a football competition, whereby the European countries gathered together to compete for the greatest honor, which is the European Championship. And this occurs in one of the group stage, whereby Denmark went against England on the 13th of June. So on the left side is a short video that I want to show you. We showed the collapse of a Denmark player. So again, I would like to stress that sudden cardiac arrest occurs to all age groups. And bear in mind that these players are not just average sportsmen, they are elite players like Marquis Kido. He was a former World Olympic champion. And this Denmark player, he's actually playing during the European Championship, which was a high-level tournament. And what about the statistics of a sudden cardiac arrest in Asia Pacific, which is more relevant to us? So this is a recently published study showing the outcomes of the out-of-hospital cardiac arrest across 7 countries. These 7 countries are Singapore, Malaysia, Thailand, Japan, Korea, Taiwan, and United Arab Emirates. The number of patients involved in this study is 66,780. And the results are actually very alarming to us because it says here, overall survival to hospital discharge varied from 0.5 to 8.5%. This shows that the survival rate is actually very low, whereby out of 100 patients, you only have 1 or maybe up to 8 survival out of the 100. And survival with good neurological outcome also is very low, ranges from 1.6 to 3%. This has to do with the chances of survival when the minutes and also the duration when the victim collapse. So what you see here is a very nice diagram showing to you on the right axis is the chances of survival, and on the x-axis is actually the duration by minutes. So every passing minutes, there's a drop of and 10% and an average of 10% of a survival rate. So if the patient has not is not resuscitated during the duration of more than 10 minutes, the chances of survival is actually very low. So that is why the AED and also high quality CPR is very important in terms of handling sudden cardiac arrest. So what is an AED? The actual name is called the automated external defibrillator. It is a machine that actually delivers an electrical shock through the heart from the patient's skin. This electrical current will stop an irregular heart rhythm and allows the heart normal electrical system to reorganize and pump blood again. So the recently published 2020 American Heart Association guidelines, they do recommend that rescuers use AEDs with a CPR feedback. So what you see on the pictures below is an AED with its accessories. There's the body of the machine, Then you see there's two electrode pads, and what you see is a special part that is situated in between these electrode pads. This has the function of a CPR feedback. So let's talk more about the high quality CPR and what is it all about. So as you perform CPR on a arrested patient, this CPR actually provides blood to the brain. And in turn, it also moves the blood through the heart to supply oxygen and also blood flow to the heart as well. And as you release during the relaxation phase of the CPR, right, this will actually evacuate blood from the distended heart, evacuate blood from the body to the distended heart. And the guidelines made it very clear that CPR, the compression rate has to be done at the rate of 100 to 120 compressions per minute and at the depth of 5 to 6 centimeters. They also talk about no leaning and ensuring full and rapid release. So if you're using a AED device from Zoe, they have a special technology called the Real CPR Help with the audio and visual feedback. So what is this all about? So as I zoom in the screen of the AED, what you see here is this visual feedback that you can see. It shows you that if you're not pushing hard enough on the patient's chest, it will prompt you to push harder. And if you are doing a good job, it will prompt you saying that you're doing a good compression. So this is very important, especially for lay rescuers, because this will actually guide them in performing a high quality CPR. So what needs to be done during a sudden cardiac arrest? I have this video, a short video, to demonstrate to you what are the steps and what needs to be done during a sudden cardiac arrest. Please enjoy.
Cardiac arrest is a leading cause of death worldwide, and it can happen to anyone, anywhere, at any
Anyone
age.
see what happened? Michael, are you okay? Are you okay? You call emergency services, you get the AED. Hurry, I'm gonna start CPR.
Call emergency services, have someone retrieve the AED, and begin CPR immediately.
Yes, please send help.
Placement of the AED should allow for retrieval in 3 to 4 minutes.
Yes, we have an AED and we've begun CPR.
Place the AED next to the victim's shoulder. The AED provides both voice and text prompts, as well as graphic icons. Text prompts can be helpful in noisy environments, and icons are useful in multilingual environments.
Adult pads. Stay calm. Check responsiveness. Call for help.
All clothing must be removed from the victim's chest. Excessive chest hair and moisture should also be removed if present. The pad package includes scissors, razor, and other items to help prepare the victim for proper application of the pads. Completely expose the victim's bare chest. When using the scissors, always begin at the top of the shirt, cutting downward. Zoll's one-piece CPR-D pads are designed for fast and accurate placement. Peel and place design helps prevent pad damage and mishandling. The CPR-D pads have a CPR sensor built in that provides feedback to the rescuer on CPR compression quality. The landmark also supports proper CPR hand placement.
Don't touch patient. Analyzing.
Do not touch the patient in order to prevent interference with the heart rhythm analysis. The AED Plus analyzes the victim's heart rhythm to determine if a shock is needed. AEDs are safe and will not shock a victim with a normal heart rhythm.
No shock advised.
While only about 50% of cardiac arrest victims
Start
will require a
CPR.
shock from an AED on the first analysis, nearly 100% of victims will benefit from high-quality CPR. High-quality CPR helps maintain the flow of oxygenated blood to the heart and brain. Maintaining the flow of oxygenated blood can improve shock success and minimize long-term damage to the heart and brain. The CPR sensor built into the CPR-D pads allows the AED Plus to see when you are doing CPR, as well as measure the quality of the compressions being performed in accordance with the most current guidelines.
Push
The
harder.
AED Plus provides periodic text and voice
Push
prompts
harder.
to remind you to push harder if compressions are too shallow. The compression depth indicator provides real-time visual feedback on the depth of compressions being performed. Keeping the indicator between the markers helps ensure optimum compression depth based on the most current guidelines. When CPR compressions are performed at guideline-compliant depth, the AED Plus gives the rescuer a reassuring, good compressions. The AED Plus also uses an adaptive metronome that speeds up or slows down to help guide rescuers to a guideline-compliant CPR rate. CPR depth and rate are two very important components of high-quality CPR. CPR is strenuous, and it's not uncommon for rescuers to tire and perform compressions that are too shallow. If they do, the AED Plus will again
Push
remind
harder.
them to push harder. Providing high-quality CPR to a cardiac arrest victim can result in a shockable rhythm on the next analysis.
Don't touch patient. Analyzing. Shock advised.
Make certain nobody is touching the patient before pressing the shock button.
Press flashing shock button. Shock delivered.
Begin CPR
Start CPR.
immediately after the shock is delivered. Even after a shock has been given, a struggling heart needs high-quality CPR to help it
Start
recover to a
CPR.
normal rhythm. Continue doing CPR until the patient regains consciousness or emergency services arrive to take over the rescue. Rescuers can tire when performing CPR. Guidelines recommend that when possible, rescuers take turns performing CPR to help maintain CPR quality.
Yes, and that is all for my presentation. So my take-home message for you today is that sudden cardiac arrest can occur anywhere, anytime, on anyone. And the chances of survival decreases with every passing minute without CPR and also defibrillation. So early defibrillation and also high quality CPR improve survival outcomes for sudden cardiac arrest victims. With this, thank you for your attention, and I'm going to pass this back to Carol. Carol, over to you.
Thank you, Dr. Jimmy. This was a really insightful session. It's so sad to hear about any sudden death cases in the worldwide. But now I'm sure everyone, most of you have gotten a better understanding of what sudden cardiac arrest is and the steps that we should all take in order to encounter a victim one day. Next up, I would like to introduce what SADS is and also share about the sudden cardiac arrest landscape in Hong Kong. Now I would like to share the PowerPoint through the screen. Believe that everyone can see the screen, our PowerPoint. SADS Hong Kong Foundation is founded in 2013. It's 8 years ago. Registered is a charitable organization in Hong Kong. Our mission is to save the lives and support the families of children and young adults who are genetically with the sudden death due to the heart rhythm issue. We are devoted to spreading message to SADS and their cardiac health. So what is SADS? SADS. Sudden arrhythmia death syndromes are heart rhythm problem that can cause sudden unexpected death in young and apparently healthy people. There are 3 warning signs. Number 1, family history of unexpected and unexplained sudden death under age 40. Number 2, fainting during exercise, excitement or upon sudden shock or surprise. Number 3, consistent or unusual chest pain or shortness or breath during exercise. However, people in Hong Kong don't have much understanding and awareness in Hong Kong about SADS. That's why we would like to take more education panel, the platform to introduce what is SADS to the general public. And now, I would like to share our Ambassador Dixon Yu's story. Mr. Dixon Yu also experienced sudden cardiac arrest 3 years ago. He is a Hong Kong artist in TVB and former members of the Hong Kong swimming team. He collapsed during taking a rest by side after playing football. Luckily, he was given first aid by a friend and treated with an AED just within 2 minutes. He stayed in ICU for 1 month and recovered and back to the rest just after 2 months only. Thanks for his support, He accepted our invitation as our ambassador, and now he is very active to promote the public awareness about SADS and also the cardiac health. SADS Hong Kong Foundation is organized a series of public education events to raise the awareness of SADS among to the general public. We hold various seminars, talks for the public, schools, associations. We also organize many CPR AED workshops for the demonstration. Besides, we also have a public event on May 2019, just before COVID-19, which invites more than 100 secondary school students to do CPR AED together in the shopping mall. We also have a large education campaign to raise the public awareness and understand more about SADS. For example, we made many videos last year and this year and invite the cardiologists to talk about the symptoms and the treatment of SADS. We also line up with some youth channels from YouTube and Facebook and other organizations, just like Today through Medical, to let more people know more about SADS. Of course, if you want to know more about SADS, please visit our website or Facebook. And with that, now I would like to pass the time on to Dr. Lim. Dr. Lim is an emergency physician practicing in Singapore, and he will share his personal story on how he had the chance to rescue his neighbor earlier this year. He will also share with us on what CPR is and how we should be doing this. So Dr. Lim, over to you.
Thank you, Carol. Thank you, Zol, for inviting me. I'll share my screen. Just give me a moment. All right, so as Carol mentioned, I work as an emergency physician in Singapore, but today I come to you as a regular citizen in a community. So being an emergency physician, I'm naturally trained in CPR. So what I actually have is I have an app on my phone that notifies me if there is a cardiac arrest that has happened nearby. So if somebody were to call 995, the emergency services, and they have a cardiac arrest, this app will notify me based on my location. So I remember very clearly earlier this year, the date was 12th of February, it was 10 p.m. I was just sitting on my sofa, checking through some messages and well wishes. And then suddenly I get a push notification from this app, my responder, and it tells me that there's a cardiac arrest. And I looked at the address, and it's like, it's just down the road. It's literally on the street where I'm living in, and it's just 3 houses down the road. So after I got over the shock, I probably got up from my sofa, I briskly walked, rushed over, okay, to my neighbor essentially, okay, 3 houses down. And then I saw the domestic helper looking really shell-shocked. The gate was open and the main door was also open, apparently waiting for the ambulance to arrive. So I introduced myself. I said, I'm a doctor, I'm here to help. And I was directed upstairs, and lo and behold, it was my friendly elderly neighbor who used to walk up and down the street every morning and wishing everybody good morning. He was very well, 90-year-old man until then. And he was in cardiac arrest, and his son was doing chest compressions or CPR on him. So I introduced myself again, and then I volunteered to take over the CPR since I was specifically trained in it. Yeah. So there I was doing chest compressions, and then the next thought in my head is, where's the AED, right? So I look at my app. I look at my app, and I couldn't locate a nearby AED. I'll tell you that story later. But just let me pause the story currently. Let's talk a little bit about CPR. I think Dr. Jimmy has already introduced you to it. But what exactly is CPR? It stands for cardiopulmonary resuscitation. Why is it important? Well, in cardiac arrest or cardiorespiratory arrest, basically the heart and the lungs have both stopped working. So we want to, take over the functions of the heart and lung. So we do chest compressions to compress the heart so that there's blood flow. And if possible, we also do ventilation, so to breathe for the patients. We pass oxygen or air into the lungs for ventilation or for breathing. Now, of course, early defibrillation with AED, as described earlier, is also very important. And how do we do it? You just put your hands on the chest in the lower half of the chest bone or the sternum, and you do chest compressions at about 5 centimeters, 5 to 6 centimeters, at a rate of about 100 or 100 to 120 per minute. So what's a rate of 100 per minute? Not all of us have a metronome in our head, right? So I always say, remember the song, the Bee Gees, Staying Alive? Okay, if you do chest compressions according to that beat, that would be approximately 100 per minute. So where can I learn it? Well, you can learn CPR in any first aid training center, or in Singapore, you can go to many community centers that actually run courses regularly. Okay, so back to the story I wanted to tell you about the AED. So while I was doing chest compressions on my poor neighbor, by training, we think about early defibrillation with an AED. So I look at my app, okay, the same app, and it actually shows me where is the nearest available AED. But as you can see, my location is the blue dot here. That's right here. And you can see that I'm nowhere near an AED because we were staying in a private landed estate, private houses, and most of the AEDs are placed in community buildings, public buildings, or shopping centers. So the nearest AED was easily 900 meters, 1 kilometer away. If I were to run there and back, I think I'll probably need an AED for myself. So no choice. The only option I had was just to continue high quality CPR as much as I can and just wait for the ambulance to come. So when the paramedics arrived, the ambulance, they had an AED, of course, and when they applied the device onto the patient, unfortunately, the patient was already flatline or in asystole, and there was no suitable shockable rhythm for the AED to do its work. Yeah. So I put in I got intravenous access. I put in an IV cannula, okay, which is a small little needle and tube into the vein of the patient, and we gave a first dose of adrenaline for the patient. And then they applied oxygen. You can see here the mask. Sometimes they use a laryngeal mask to apply oxygen to the patient, and promptly transported the patient to the hospital, to the nearest hospital, which happened to be the one I was working at. So I was able to make a quick phone call to my colleague on duty, all right, that evening, and just give him a brief rundown on what happened. And actually what happened when the patient arrived at the A&E, they started advanced care, patient was intubated, they received all the necessary medications, and they actually revived the patient in the emergency department, meaning they actually got a heart beating again, they got spontaneous circulation again. So the patient actually made it to the ICU, but unfortunately later on in the evening, we found out that patient passed away in ICU, probably because of the extent of the heart attack, and also because he was 90 years old with not much reserve. in your body. Yeah. So on reflection, I was thinking as a system, how could we have done better? So there's this concept of chain of survival when there's out of hospital cardiac arrest and getting the patient to the hospital with the heart beating again, right? So early intervention, yes, prompt recognition. The son had promptly recognized that this was something really serious. He called the ambulance, right? Early access, and then he did a high standard CPR, which was great. And because of technology, I was also alerted, and I continued with the CPR. But you can see that the missing link here was we could not do any defibrillation because there was no nearby AED. And the arrival of the AED only came with the ambulance, which was a bit delayed. So come to the end of my story. So some take-home messages. I would say that we can make a difference. Okay, there are many of us out there in the community. All of us can get trained, and we can all make a difference together. Okay, and then don't forget that CPR and AED go together. All right. Do CPR first, and while doing CPR, remember to get AED. But when the AED arrives, don't get distracted by AED. Don't forget to continue CPR when they're doing the preparation. Right. So yes, basically that's it. I'll be happy to take questions towards the end, probably at the Q&A session. In the meantime, I'll hand over this back to Carol. Thank you.
Thank you, Dr. Lim, for the great sharing. Through his story, we learned that it is important to have AED around us and to provide high-quality CPR in order to increase the chance of the victim survival. So next up, we have Jennifer and Ricky, who will be sharing their story on being a rescuer and survivor as a workplace in Australia. Unfortunately, they are unable to attend this regular live, but we have the opportunity to pre-record their presentation and the interview. Over to you, Rachel.
All right, so thank you, Carol. So hi, everyone, I'm Rachel, Marketing Manager of Zoe Medical. So today we're very honored to have Jennifer and Ricky from Australia. So both of them are working for Coles Supermarket, and in 2019, Jennifer was part of the team that decided on a Zoe AED for the supermarket's chain AED program. So 2 weeks after the AED's installation, Ricky actually collapsed from a sudden cardiac arrest. And it was also Jennifer who performed CPR and resuscitated him with the very same AED that was installed. So without further ado, let's welcome Jennifer and Ricky to take over, and they'll be sharing their thoughts and feelings about the incident. So over to you, Jennifer.
Thank you, Rachel. Hello, everyone. My name is Jennifer Maxwell, and I would like to share with you our story about defibrillators. So I work for Coles Supermarkets. We're a large supermarket chain that is national across Australia. We also have liquor stores and Coles Express stores, which are linked to our petrol stations. With supermarkets, we currently have 838 supermarkets and 5 support offices that are national across Australia. Within each store and support office, we have actually fitted out at minimum 1 Zoll defibrillator in each of these locations. In the support office, the national support office here in Victoria, we have approximately 10 units, 1 on every single level, as well as located in the gym, first aid room, and with the security guards, which they take to an incident. In 2019, we completed a tender because we were interested in looking at what it would take to install defibrillators in every single supermarket. We reviewed products from 5 companies, and the criteria was ease of use for non-medical, because we wanted our team members as well as the community to be able to use these in an emergency. We wanted to see what was the expected unit lifespan as core compliance, the difference between semi and fully automatic, how long the time was it to shock when you were using the units, and also the warranty and the maintenance. So the lifespan on the pads, how long do they last if you don't use them, as well as the batteries that are within each unit. We awarded the tender to Zoll, and with Zoll, as well as with our partnership with City FM, we installed the cabinets and the units to every single store. We've made sure that the units are in a visible location at the front of the store for community awareness, as well as ease of access. So we've had a number of cases where an incident has happened within the shopping centre, and it's someone from the pharmacy that's run in to use our unit. So as you see here, in FY20, we actually used the defib in 33 emergencies, and in FY21, we used it 21 times. So this is more times than we were ever able to use or save a life than prior to not having the defibrillators installed in our units. We also found that a couple of occasions, the team members were preparing to use the unit in an emergency, but either the patient was not having a cardiac arrest or the ambulance beat us to it and used their unit, not our own. So I've just replaced the pads for those stores. Now I'd like to share with you a video that was filmed and broadcasted on our national network, which actually discussed the installation of the defibrillators and an emergency that actually happened close to home in our support office.
Supermarket giant Coles has installed defibrillators at all of its stores. The company had a recent scare itself when an employee collapsed in front of his colleagues who helped save his life.
The last time these men were all together, it was in very different circumstances.
Good to see you, mate. Well done, Rick.
Coles employee Ricky Avery was having a coffee with workmates when he suffered a cardiac arrest.
I grabbed my chest and said, I don't feel very well, and just slumped forward.
He just collapsed in front of me. I thought he was joking, and I even asked him, are you joking?
After receiving CPR from his colleagues, the MFB quickly arrived on scene, firefighters using a defibrillator to keep Mr. Avery alive.
It's really satisfying to see Ricky up and about and so healthy. His colleagues saved his life, I would say. Sometimes these sort of big things happen to you for a reason. It just shows what a great job these people do.
Coles have now introduced defibrillators into all of their supermarkets, and 000 call takers know exactly where they all are. It means that if a customer calls from anywhere in the store, they'll be directed here to the machine.
It is a game changer. The moment somebody steps in and starts chest compressions, they have doubled that person's chance of survival.
Defibrillators are also being rolled out in all Woolworths supermarkets. Estelle Greepink, 7 News.
7news.com.au.
So thank you, Jennifer. That was a great sharing. So what actually went through your mind when Ricky collapsed, and how did you recognize that he was suffering from a sudden cardiac arrest?
Right. Well, what actually happened that morning, Rachel, was myself and a colleague were upstairs discussing meetings of the day, something like that, where we got a call to say that there was an emergency in our bistro area. Oh, plus myself and my colleague are actually both part of the safety team within Coles Supermarket, so that is why we got the call. So we ran down to the bistro to see whether we could assist in any way, and there was a group of people huddling around someone who had collapsed onto the ground. We saw people doing chest compressions, and I also noticed that the security guard was struggling to open up the defibrillator. So without hesitation, I ran straight in, grabbed the defibrillator from the security guard, opened it up correctly, knelt down. We took Ricky's top off, and I was able to install the defibrillator pads on the correct locations and then activated the unit. So from then on, I was monitoring the guys doing the CPR because they were doing it in rotation, as well as following the prompts from the AED machine, and then making sure everyone was clear when the machine actually did its strike, its shock. So yeah, so that's what I was doing. At the time, there was nothing else in my mind except just to go through the motions and make sure everything was working to give Ricky the best chance of life. It went through twice with the shock, and then the ambulance arrived and we stepped back and they took over. So yes, that's what happened. It was a very surreal experience.
I'm sure. I think Ricky is really lucky to have you around because you're like so trained and you were very confident in what you were doing. So what actually happened like during the incident, like how did the people around actually reacted to it?
Well, when we arrived, there was already people that were doing the CPR, which was amazing. So they were trained first aiders, because we do offer first aid training within our stores as well as within support office for team members. So they were trained, they knew what they had to do. And then there were others that were surrounding, trying to clear the area to make sure that there was privacy. And there were others that were in touch with the ambulance as well as our directors to make sure that everyone knew what the situation was, as well as others calming spectators, because they were a little bit upset by the whole situation.
I'm sure. Okay, so is there anything you would like to share to the participants tuning in?
Well, I think what really helped me in the situation was that I was quite au fait with how to use a defibrillator. I had been working with Zoll doing the rollout, and I'd been watching the training video, because with Zoll, we provided a training video for every single store team member to watch online, so that they knew how to use it and weren't fearful of the device. And because of that, I knew how to open it correctly, install the pads, activate, and knew I could trust in listening to the instructions. So I think that was really important.
All right, thank you, Jennifer. I just hope that everyone could be more like you, to be very aware of the importance of knowing how to use an AED. So now we have Vicky with us, so we'd like to have some questions with him as well. So Vicky, what are some memories that you have from the incident?
So on the morning of the incident, I completed a spinning class in the gym at Coles and felt really groggy after the session. I've just obviously carried on with my normal day, went back to my desk and started my working day. I caught up with one of my colleagues at 9 o'clock, Eric, on the balcony for a coffee. And then that was the last point that I remembered, obviously, what happened. The feedback from my colleague, Eric, was that I put my hand on my chest and said I was not feeling very well. Eric actually thought I was messing about and quickly realized this was a serious situation.
Right. So when did you actually manage to regain your consciousness, and how did you feel at the time?
So I regained consciousness in the ambulance and told the paramedic that they needed to contact my wife, Lisa. I felt very confused and not really aware of what happened at that point in time.
Okay, so how did Lisa actually react to the incident when you called her?
So my family was very upset when the news of the cardiac arrest and was quickly taken to the hospital by my core colleagues. Coles was brilliant with the support of my family, and even put my family up in the hotel close to the hospital as well.
Okay, so were there any post-sudden cardiac arrest side effects that you experienced, and how was recovery like for you?
So my post recovery from the cardiac arrest has been pretty good, and I was phased back into work part-time over a number of months and then back up to full-time. I have a pacemaker fitted, which is checked every 6 months, and all in all, so far it's going really well.
Okay, so is there anything you would like to share to the participants tuning in?
Yeah, so 2019 was a really tough year for me and my family with my cardiac arrest in July, and also my wife was diagnosed with ovarian cancer in May, which is obviously continuing that fight to this day. Zoll kindly donated a defib machine, which I give general consideration where I would want to do it within the community or where I live. And I picked a shop which is the closest defib is 3 kilometers away. And it's been advertised in the local community about this defib in the shop, and also has been shared with all the campsites as well. So really happy that in the future that will help save someone else's life in the future as well.
All right, thank you, Vicky. So we're very thankful for both Jennifer and Vicky's time. So we hope you guys have actually enjoyed and learned something from their presentation. So with that, I'm going to pass the time on to Shani. So she'll be going through some Q&A questions with you. Thank you.
So hi everyone, it's Rachel actually, not Shani. So I'm actually coming to you live this time.
So we're actually nearing to the end of our webinar. So we actually like to touch on some of the Q&A questions. So before I start on this segment, I just want to recap a little bit on the interview that we had with Jennifer and Vicky. So I think we can all agree that Vicky was really very lucky to have like so many people around him when the collapse happened. And I think the key reason why he recovered so well was because he had very early defibrillation, and he also had high quality CPR performed on him like right there and then. So we all know that, time is of the essence, as what Dr. Lim has shared. And that's why we all understand that the importance of having the knowledge of using the AEDs and also having it around, and also having the knowledge of performing good CPR. So, okay, so we'd like to go through some of the questions. So you can see that there are some questions flashed out on the screen already. So these are the questions that we received before the webinar. So the participants actually reached out to us. So the first question is actually directed to Dr. Lim. So Dr. Lim, if you're there, please unmute. Okay, so the first question is it safe to do CPR during COVID-19?
Yes. Well, I would say that in this time of COVID-19, being out in the community, just by simply walking down the street, you will be subject to some risk of contracting it, right? If there's community transmission. And what more if you're called to attend to a cardiac arrest and you are actually in close contact with patients. So of course your risk will be higher, but we can always take the necessary precautions. Yeah. If there are gloves available, put on your gloves, keep your mask on, and even the patient, you want to stay a distance away from the mouth and nose and secretions of the patients when you're doing the chest compressions. During your training for your basic cardiac life support, you'll be taught ventilations, together with chest compressions. And we used to be taught mouth-to-mouth ventilation, but of course, in the time of COVID, my recommendation is to concentrate and stay on just chest compressions. Pre-hospital, before a patient gets, that means pre-hospital before a patient gets to the hospital in the community, it is perfectly acceptable to do just chest compression CPR without doing the mouth-to-mouth resuscitation. So that would be my recommendation. It was exactly what I did when I responded to the case. If you do literature search in the medical journals, you'll find studies where people have compared pre-hospital CPR with chest compressions only and chest compressions plus ventilation. And they found that on arrival to hospital, the rates of returning the patient to a spontaneous circulation are actually equivalent. Yeah, so with regards to cardiopulmonary resuscitation, the chest compressions probably are a lot more important than the mouth-to-mouth ventilation. Yeah, so that's my answer.
All right, okay, so thank you, Dr. Lim. So yes, the answer is yes, and because CPR is still the main portion of resuscitation, right? So we can still go ahead and resuscitate someone during COVID-19. So the next question is directed to Dr. Jimmy. So the question is, what if I'm unsure if the victim is in cardiac arrest? Should I initiate CPR? So Dr. Jimmy?
Thanks, Rachel. So this is a very common question that's being asked to me, right? Because unlike the medical personnel, a layperson like yourself probably is not well trained to recognize whether the victim is in cardiac arrest. So in a layperson context, right, if you see a patient who collapsed on the floor, right, the first thing you would need to do is to check the surroundings if there's any danger to you. If there's no danger, then you should go ahead and check on the patient. So two things you need to check. Number one is whether or not he or she has any reaction to your call, or you try to touch him or try to tap on him, he doesn't have any reaction. The next thing you should check is whether he or she has any breathing. If no breathing or agonal breathing, like having difficulty breathing, then you should start CPR. In fact, the latest American Heart Association journal actually published this in last year's guideline. It says that they recommend that laypersons initiate CPR for presumed cardiac arrest because the risk of harm to the patient is low, even if the patient is not in the cardiac arrest. Yep, so I hope this answers the question.
All right, thank you, Dr. Jimmy. So the answer in short is yes. So the next question is to Jennifer. So Jennifer, we have her live today. So Jennifer, the question is, after the incident with Ricky, were there any changes to the AD program in Coles Supermarket? So for example, were there any more AD trainings for the staff?
Yes. Hello, Rachel, and hello, the audience. It was actually a timely reminder. Oh, I have put my video on, but
it's working fine.
It's working. Oh, sorry, I couldn't see myself. Okay, so yes, it was actually a timely reminder for myself and the team to review our training program that we had commenced with the store. On our review, we decided that it was actually pretty comprehensive. So we were happy with what we arranged, which was the online video training through Zoll that is on our own learning hub. And then each month I send out a reminder for the team to, when they're doing their hazard hunt, to actually review the defibrillator. Has it got a green tick or has it got a red cross? And that way it's got a monthly check as well. So no, we were actually really happy. One thing to note though is that when Ricky did come back to work, he, as well as Eric, who was his colleague that he had coffee with, were very interested in becoming first aiders so that they could actually pay it forward and help someone else that was in the same situation if that was ever to occur. So we arranged for in-house first aid training through St. John's. They came, and Ricky's now a very happy qualified first aider. So yeah, thank you.
Okay, so thanks, Jennifer. I think it's very heartening to see that, you know, more people were actually more aware of it and were also more open to learning it as well. So, okay, so now we'll just jump right into the Q&A box. Okay, so there are actually quite a lot of questions that you guys have typed in. So we have seen it, we have answered some of them. So for those that are not answered, we're just going to go through it now. So I think Ryan actually asked, you know, the price of purchasing an AED. So for this, right, we have a QR code at the site over here. So for those who are interested to get in touch with Zoe, you can always scan it and leave your details behind and we'll get in touch with you. So secondly, another question by Ying Shu. So she mentioned that SCA and heart attacks would probably look the same to a lay person. So how can I differentiate these two clearly? And can I use an AEDs on person with heart attack as well? So I think for this question, maybe Dr. Jimmy, you can answer this. Jimmy, can't hear.
Oh, sorry.
Yeah.
So as I presented earlier, right, sudden cardiac arrest and heart attack, they have two very distinctive features. So that feature is actually the patient, whether he or not is still conscious or totally unconscious at all. So if you see a patient who is still conscious, but he is in pain, he looks to be in pain, his hand is putting on his left chest, and also he has profuse sweating and also difficulty breathing, most likely that is a heart attack symptom. But for sudden cardiac arrest, on the other hand, he wouldn't have any symptoms at all, apart from being unconscious totally. So just like the video that I've shown, right, like this Denmark footballer, he just collapsed halfway through while playing this football tournament, right? So that is the most of the time this will be presented in a cardiac arrest patient. So again, for sudden cardiac arrest, you need to defibrillate as soon as possible using an AED. But that doesn't mean that the heart attack patient won't go into a sudden cardiac arrest. So a heart attack patient, you cannot use an AED to treat him, right? The immediate treatment should be call an ambulance immediately or send him or she to the nearest hospital or healthcare system, whereby over there they will deliver an appropriate treatment for this kind of patient. Yep, I hope that answers the question. Yep, thank you.
Yes, thanks, Jimmy. Thanks, Dr. Jimmy. All right, so the next question is will be directed to Dr. Lim. So a question from Tian Si. Okay, so she's asking, what is the medical litigation for causing injuries during CPR?
Yes, this is an interesting and tricky one actually. Yeah, I would say that in societies where there are more litigious with higher risk for litigation and lawsuits, generally there will be a Good Samaritan law that will protect first responders who attend to CPR. But well, in Singapore, in our experience, we at least currently we are generally low to moderate in terms of our litigation. So we do not actually have a Good Samaritan's law in place. And actually this thing has been argued in Parliament over the past few years. But there hasn't been any cases whereby people have tried to claim against first responders for causing injuries like rib fractures, things like that. So the courts in Singapore are generally quite supportive of first responders. Yeah, I mean, even in the hospital when we do CPR, I definitely have cracked lots of ribs in my career, and you know, a cracked rib versus saving a person's life, you know, it is quite obvious which one takes precedence.
Definitely, I agree as well. I mean, a cracked rib will definitely heal, right? It's just a time is needed, but you know, definitely it's more important that, to save a life. Okay, so the next question is, in an open area incident when it's raining, can we still use an AED? So Dr. Jimmy, do you have an answer for this?
Yes, so the concept is really simple. In the time of resuscitation, the first thing first, we need to ensure the rescuer is safe to perform a resuscitation. So in a scenario where the rescuer is not safe, he or she himself, right? So then there's no point because this person might go into danger and collapse as another victim of sudden cardiac arrest as well, right? So in this scenario whereby if it's raining, right, the best thing to do is actually transport this patient to a nearby dry place, or at least places where it's not affected by the rain, because as you remove the patient's clothing and also put on the electrode pads, right, that patient's body also has to be dry, right? There's no point putting on the defibrillation pads on a wet patient's body. So the another consideration is also that we are also delivering a shock, defibrillation shock to the patient. So in a scenario whereby the surrounding is wet or if it's raining, right? So when the shock occurs, that shock may be conducted through the water and affect the rescuer as well. So the best is still first find the best place where you can perform a safe resuscitation. Yep. Thank you.
All right, thanks, Dr. Jimmy. I think we're running out of time, but we should be able to squeeze one last question. Okay, so this question is by Mr. Prasad. So he's asking, in the event whereby there is no AED available, should we just continue CPR on and on? Is there a time limit whereby we should stop CPR? So do you have an answer to this, Dr. Lim? Dr. Lim, you're muted.
Yes, hi.
Okay.
Yes, can I look at the question again?
Yeah, so the question is like, in an event whereby there is no AED available, how much time should be given on CPR? Is there a time whereby, you know, the person should decide to stop CPR, or like, should he go on for a certain recommended amount of time?
Okay. The idea is that you should continue CPR until help arrives. So you just continue CPR until the ambulance arrives and the patient is transported to the hospital. Yeah.
Okay.
So really, as long as it's necessary, it's very tiring, but it'll be good if you have more than one person doing chest compressions in this case. Yeah.
Yes, correct.
Yeah.
So I think in the hospital settings, it's usually like a two-person thing. When one gets tired, another comes in, and then when he's tired, then the other person comes back in. So,
yeah, I also would like to add on to this, right? So that is why in the flow of a basic life support resuscitation, right, the first thing first is to really call for help. if you understand the algorithm, the first thing first is to call for help. So by what it means by call for help is that you call the emergency healthcare, which is the ambulance, to arrive, and also reach out to other people for two reasons. Number one, to get an AED, right? Number two is to help you to perform CPR. So as you grow tired, you rotate the chest compression, the person who do the chest compression, and keep doing this until the help arrives.
All right.
Yep,
Okay. So thank you, everyone. So this sums up our Q&A questions. I know more are coming in. I'm so sorry we can't answer to everyone. But at the end of the webinar, we're going to have a QR code shown. So if you have any questions, please reach out to us. Okay. So now I'm going to pass the time on to Christopher Barnabas. He's our Vice President of Zoll Medical. So he's going to be doing a closing for us. So over to you, Mr. Christopher.
Thank you very much, Rachel. And also, thank you very much to Carol Lee from SADS Hong Kong Foundation. Thank you for being the host. To the speakers, Dr. Lim En Kun, the emergency physician from Singapore. Thank you. I know you're always very busy to take your time off to be at this session. Dr. Jimmy Jot, also an emergency physician from Malaysia. Our hero for the day, Jennifer Maxwell. You know, if you, so many things that she could have done differently, but she decided. Hi, Jennifer, to proceed with this program of having AEDs at all coals, right? If it wasn't for Jennifer and her team, Ricky would not be here speaking. And to Ricky, our starfish, right? I've got a starfish story that the single survival, that every single survival makes a difference. And I appreciate the fact that Ricky took the time, right? So just a quick one on Zoll. Zoll is a global resuscitation company, and we continue to work on awareness programs across the world. Zoll started, the company started actually by also cardiologist, Dr. Paul Zoll, electrophysiologist rather, in Boston in the US. And he was the first in the 50s to develop and externally use a defibrillator and a pacer. So if you Google Paul Zoll, you'll get a long story. Until today, Zoll continue to work closely with organizations, with the healthcare professionals like Dr. Lim, and globally, we've also continued to work with organizations like FIFA, the World Football Body, also the Asian Football Confederation. We've continued to work with them, and also with public organizations and private organizations, foundations, like where Jennifer works. So we continue to do that. And why do we do that, right? We do that because survival rates of cardiac arrest is still extremely low, right? Across the region, it ranges out of hospital cardiac arrest, particularly ranges between 1% to 10%, which is extremely low, with one of the highest deaths amongst all diseases. Cardiovascular death is one of the highest, right, in many countries. So survival is extremely low. But we're fortunate to get a story like Ricky that was safe, and he comes back and he tells the story and how fortunate he has been, and all the people that was surrounding him, that was supporting him. We also hear about the Christian Eriksen story. I was watching the game live. I don't know about you guys, right? It was like almost 1 a.m. in the morning in Singapore, and you could see him collapse, right? And I was practically almost running into the TV and trying to save him, because you could tell that he had a cardiac arrest. And I'm glad that there were trained professionals around him that were very quickly aware of the situation, and they did everything that was right, and he finally survived, right? But we also hear of stories like Mickey Kido, the badminton star from Indonesia, that didn't make it, right? Which is sad. So Zoll has got a device that is called the hospital wearable defibrillator. It is different from AED. AED is put in the public, but we've got a device that is called the wearable defibrillator, and it's used in hospitals. We have just launched it in Malaysia and Thailand, and Singapore will be next. These are for high-risk patients that are in the hospital, mainly pre and post cardiac surgery, that they will use this, and they wear it 24 hours for a couple of days before and after a surgery, right? That device has a survival rate. We've done clinical trials on that device, and that device alone has a survival rate of 98.7% on cardiac arrest. And what does that mean, right? That cardiac arrest is savable, right? Why are we still getting 1 and 2 and 3% survival in many, many countries in our region here in Asia Pacific, right? When we've got a device that can give you 98.7%. I don't encourage everybody to be wearing that, right? But what I'm trying to say is that despite the very high percentage of patients who don't make it, that if we have the right awareness program like this, if we've got good and great first responders that you've seen in the cases in Coles, Australia, and also in the football game in Europe, and also with trained people around you and with an AED, that survival is possible, right? So therefore, I encourage everyone who is in this call to, if you've not been trained on CPR, please go out and get trained on high quality CPR, right? You can make a difference, as you heard from Dr. Lim, right? If you're concerned about legal issues, I'm glad that Dr. Lim covered that earlier on. But really, I've spoken to a lot of legal experts, right? And Dr. Lim confirmed that there has been no case of any litigation if you're trying as a medical professional or a layperson to try and save a cardiac arrest victim. But what has occurred in the past is that the other way around. There have been cases where somebody collapsed and bystanders have not reacted. You have not tried to do something to save somebody who have collapsed. There have been cases brought against some people who have not done anything, right? So the message is, if you can help, do help, right? There's been no cases, as you heard, in Singapore and in many parts of the world where if you really try and genuinely try and help someone, that you will be sued for breaking his ribs, for example, right? But the alternative could happen. So therefore, I encourage everybody to make a difference and try and go out and learn high quality CPR and get hold of an AED. If there's none, try and encourage your vicinity, neighborhood to get one, because 70% of cardiac arrest still happens within the out of hospital segment, right? As much as we try and get trained within the hospital, a lot of cardiac arrest still happens outside. So with that, I want to thank everyone. And if you want to get in touch with Zol, obviously, as Rachel mentioned, there's a QR code that you can just scan and get in touch with us. Thank you, everyone. And all those 400 odd numbers that have called in. I appreciate all your time. Rachel, you're on mute.
Yeah, so that's the end. So for those who are interested, please scan the QR code and we'll get back to you.
Bye, everyone.
Bye, everyone. Thank you for attending.
Okay, thank you. Thank you. Bye-bye, everyone.
Thank you, Carol.
Bye, Carol.
Thank you,
Thanks.
Jimmy. Thank you, Dr. Lim. Thank you, Jennifer. Thanks, Christopher.
You're welcome.
Bye, thank you.